Happy Wednesday Wellness, everybody.
Happy Wednesday.
Happy Wednesday. This week we're talking about the side effects of pediatric chiropractic. Ooh, side effects.
Are usually bad, right? You usually see a commercial for a new drug and then
lists all the side effects. And
it's usually not too great.
May cause extreme diarrhea and bloating and headaches and aneurysms.
Yes.
And just
seek care immediately if you have any of those.
Yeah. And it's like really fast. We're not going to do really fast. I'm not good at talking really fast.
No.
So,
I am, I think.
Side effects of pediatric care.
Yeah.
All really good.
All really
Turns
good.
out.
All really good side effects.
The cool thing about chiropractic is what we're doing is we're just helping your body work better, your nervous system calm down, and all of those effects are really good things that we want to see. So the biggest one, I think, is sleeping.
Yeah, sleeping's a huge one.
That's the biggest. Like, most people don't come into chiropractic for, like, sleeping issues, don't bring their kids in for sleeping issues.
Well, some bring them in for sleeping issues, but...
Yeah, I mean, usually with something else.
Yeah, I was going to say,
it's usually not just, like, my kid's not sleeping, so I want to bring them into the chiropractor. Because usually it's, like, something else that they've, seen.
Yeah, usually we're coming in for, like, maybe ear infections, constipation.
Exactly.
Colic, reflux.
Yeah, and we're usually like, how do they sleep? And
delayed
parents
speech.
are like, awful.
Sensory, ADHD. So many, like, you're usually coming in for some sort of diagnosis they've had, they're seeking help for, or some sort of symptom. And yeah, maybe we can help with that, but then there's all these other great things that can happen. So those are our side effects.
Exactly. And like the better sleep being a side effect usually happens pretty quickly too. That's like one of the most like initial signs that we're like turning on that parasympathetic side of the nervous system, that we're getting out of that fight or flight. First thing the body wants to do is rest. And so that's how we're going to improve pretty much everything else. That's how we're going to improve immune system function, our nervous system calming, how we're going to like grow and build and like do all those other things that we need to do. First, the body needs to rest so that it can get to a state that it can do all of those.
And I tell all my patients, you've all probably heard it, I always say like, oh, it's one of the first signs I know I need to be checked is I'm not sleeping well at night.
Same. Yeah.
And I'm like, oh yeah, I just know.
I didn't sleep last night. Guess I need to get adjusted.
Guess I need to get adjusted.
Atlas is probably off.
Yep. So that is one most people notice. Great side effect.
Yep.
We all need help sleeping.
Oh yeah. Side effect number 2, pooping.
Pooping. Better digestive health. Just digesting your food, your digestive system working better.
I mean, it's
that brain-body connection.
Sometimes babies poop while we're adjusting them. Usually it's like in the car on the ride home. Toddlers love to poop in our office.
A lot of pooping toddlers. But also we've had a lot of older kids with constipation recently that have been doing great under care. Yeah. Like the mom just yesterday was like, he's pooping so much. And he's been here maybe for 2 weeks.
Yeah.
So and she said before he'd hold it for 2 to 3 weeks, wouldn't go.
Oh, I just can't even imagine. That sounds so awful.
Poor kiddo.
That poor kiddo. Yeah. But yeah, I mean, that's a huge, like, what a great side effect to not...
Yeah. And he's been to a chiropractor. So we're going to do another video about just different types of chiropractic care. And so not that what they were doing is wrong. We just look at things differently.
Yeah, absolutely. There's different approaches. Like there are for anything, right? Another one, immune system.
Oh, which is important right now.
Yeah.
Who is sick right now? We've gotten a lot of calls about colds. Your kids have all gone back to school. I think by now it's after Labor Day.
Yeah.
Some have been in school maybe 2 to 3 weeks and they already have their first cold or something.
And the weather hasn't even changed like that much.
Has croup.
Yeah.
People have COVID again.
Yeah. Viruses, colds, everything going around. So
yeah. So it's like we're headed into that sick season, unfortunately. Flu season, they like to call it.
Yeah.
And we talk about this. You can watch all our videos. We have plenty of them. Go back to the fall of every year.
Yeah, fall every year. We bring it up. Yep.
About how getting adjusted can help your immune system.
Getting adjusted regularly. I mean, it's really just like keeping the nervous system again out of that fight or flight so that it can prioritize the things that it needs to. I think that's another thing is like during stressful times, like we're just transitioning back into school, so everyone's nervous system is, heightened a little more fight or flight, so we're gonna be more susceptible to those colds and viruses too. So it is like those things go together really well. So being under regular chiropractic care is gonna help just like level things out, make it not such a big like, stress swing. So getting adjusted a little more during the stressful
it's important
time.
just to return to school too, like emotional regulation.
Sleep changes again.
That's on here. That's like one of our next ones, emotional regulation. That's a huge one right now with kids going back to school.
There it is. Yeah.
You might see it that your kid just comes home a little extra tired, a little more emotional. And yes, it's a long day. It's a different transition for them. But as Annie has said, it's just that whole nervous system being in fight or flight, having and not being able to decompress.
Exactly.
So.
Yeah. So that's another one of the great side effects we see is just like kids being able to like snap themselves out of a tantrum a lot quicker.
Yeah, regulate.
Or like, regulate a lot easier.
Yeah. We had
not
a really
so upset about
smart
things.
mom, like, her kid's been under care for a while and was like, okay, well, I'm going to come in a little more often at the beginning of the school year, bring him in a little more often. Like, I know he's going to need it because she sees the difference.
Yeah.
Smart mom. We didn't even have to tell her. Like,
Exactly.
hey, get him in a little more often to help him regulate that nervous system with that
She
transition
knew
to
what's
school.
coming. Yep. Because it's always been a hard transition for them. So,
Yeah.
Yep. I think that's awesome. Improved focus. Oh, yeah, in school. Again, like getting out of that fight or flight state just allows your brain to prioritize things easier. And so like you're able to, I don't know, use logical thought and like get so out of that like emotional like center of the brain, that survival instinct. So
Or if we think of like ADHD and we do your scans on your kid and we talk about when we do the EMG, we can see a lot of activity in those muscles. So that just creates way too much noise for the kiddo's brain if they're having to get all that feedback constantly from like their posture and their muscles. So we can calm that down. I just had an awesome re-exam yesterday with a kiddo for his EMG that went from like total energy of 900 down to 249.
Which is like, that's
in his first re-exam. It was just like
wild.
crazy. Like,
yeah. So
and his
like,
mom was just like, thank you so much. Like, he loves coming here. He's doing really well. Like, this is awesome to see.
that extra 700 units.
Yeah, and that kid
has
can go towards like focusing in school.
Or the immune system, or his body recovering. It's so cool. Yeah.
He's doing really well. So yeah, we had like some great parents get their kids under care this summer to like set them up.
Yes,
really well
set them up
school.
for success for school. Yeah, which we love so much.
Posture, I guess that's a big one.
Oh yeah, improved posture. Yeah,
just because like we do see this a lot with kids, and, like teenagers, or like they're like this on their phone, right?
Yep.
And you do like you see them like able to just like open up more.
Yeah, and it looks like sit up straighter and stuff without us even like cueing it. They're just like, oh,
yeah,
yeah, it's great.
important.
Yep, and then overall well-being. That's not on our list is the like anxiety and stuff too. That's that's kind of goes along with that overall well-being, but just like the not being so like nervous and anxious, again, like kind of being able to like regulate emotions, regulate sleep, like all of those things like all comes into play with the anxiety in kiddos too.
And usually it's not just one thing. It's like, okay, the kid's constipated, he also has anxiety, he also doesn't sleep well. So yeah, they see improvement in all of these.
Exactly.
Yeah. Just like all of us. Just like us adults. We all have a lot going on.
And it helps with adults too.
It helps with adults.
Not just pediatrics.
So, if you've been thinking, like, is this something I need to try for myself? Is this something I need to try for my kiddo? September is a great month to get your scans because we're doing the diaper drive.
Yes, we are.
With Gold Coast doulas, we do that diaper drive. So you donate diapers, you get your exam for $50.
Yeah, it's pretty sweet. And you get to benefit the community.
Yeah.
Get to get a cheaper exam.
Yeah. They go to a diaper bank in Holland, I think is the only diaper bank we have.
Yeah.
But they go to people in need, the diapers, and they'll take open diapers, they'll take cloth diapers, they'll take obviously new diapers. But like if you're just a patient here right now, or someone that just needs to like, I don't know where to do these diapers, my kids, I don't agree with this size, drop them off here. We'll take them.
We'll take them year round too.
Yes, we will. We hold on to them for the year.
Yep.
Okay. Hopefully we'll see someone soon.
Yeah. Get under care.
Get under
side
care.
effects are great.
Side effects, these are good side effects.
These are
Not
good
bad
side
ones.
effects. Yeah.
Sleeping better, pooping better,
Just helps all around.
not getting us sick, regulating those emotions better.
We all need it.
That's what we all need.
Well, happy Wednesday.
Happy Wednesday.